approach to scene where a victim has been wounded by an impaled object. This could be anything like a knife, a pencil, or anything with a sharp end. What will your next move be? Depending on your next move can be the difference between life and death for the victim. This can be a very serious matter, but with enough proper guidance, you too can learn how to act quickly and efficiently in this kind of circumstance. Today I will demonstrate how to properly care for a victim who has been wounded with an impaled object. This can be a simple process with just a few easy steps to know if you may ever need to care for someone in this situation. It is especially important for one to be prepared for any kind of incident that may occur. With proper care, the victim who has been wounded may be healed within a matter of time. This is some of the things I have learned in my first aid class. Today this is my audience, and this will be my model that I'll demonstrate on. The first thing to do is check the scene. Make sure the scene is safe, not only for the victim, but for you as well. Be sure to wear protective gloves because the impaled object can be contaminated with the victim's blood. Be sure you aren't in any danger and call 911. The next step is to make sure the victim is not suffering from shock, which can be fatal. First, check any symptoms for shock. This can include sweating, paleness, thirst, restlessness, or confusion. If the victim does have symptoms, it is best to check for circulation or breathing. If there is a lack of circulation, begin CPR. If the victim does not have any symptoms, keep the victim warm and call 911. Do not give food or drink to the victim. Now that you have cared for shock, it is time to make sure the victim is in a comfortable and secure position. Now you may move the victim if needed in order to maintain the victim's safety. It is important to move the victim if they are stuck in a vehicle. Make sure you control any bleeding. Now that the victim is in a safe place, it is time to care for the wound itself. To prevent any further injury, you should wrap around the impaled object. So you're going to get your protective gloves on. You're going to need bulky dressing and 2 gauze pads. We're using the gauze pads for the impaled object, which is a pencil. So you're going to place the pencil, right, and then 2 gauze pads to hold the pencil in place. Okay, and now you get the bulky dressing. You hold it in place. You wrap around the victim's head. Okay, and then you just secure it in place, and you keep wrapping until you're on the last piece of the bulky dressing. You want to wrap just enough where it's not too tight and not too loose. The way you could check if it's too loose is place a finger underneath the dressing, and if it comes off, then it's too loose, and if it's too tight, it could cut off circulation. And you want to get as close to the impaled object as possible without moving it, because if you move it, it can be fatal. Okay, and then when you're on the last piece of the gauze pad, or the bulky dressing, you want to place it under the last part that you just wrapped around, and it'll secure it. Look how. Okay. Okay, and then now that the wound is securely wrapped, your job is almost done as you wait for the emergency medical response to take over. Saving a life can be an easier process by following the easy steps of knowing what to do when you approach the scene. Checking and treating the victim for shock, knowing how to efficiently move the victim, and properly wrapping around the wound. So in any circumstance, you'll be able to properly and efficiently care for any person wounded with an impaled object wound. You'll be able to think clearly and act quickly in order to successfully care for any person in need of your help.